Thank you, Mr. Chair. Just want to highlight one issue before we move into a brief presentation. And the one issue is our status with respect to our HIS implementation over the last few weeks. Just in general, that's going very well. Staff have done an amazing job. During everything that's going on, there was no, quote, good time to implement it, but actually we probably picked the best time to implement it, was going through this wave. And overall, it's gone very well. It's going to be a process that we talked about before it's never going to stop as we continue to change our processes for the better. Then also the underlying system will change along with us. So it's an evolution, but the biggest hurdles have been overcome at this point. And now the clear benefits of the system are starting to come to the surface with respect to patient safety, patient quality, and hopefully patient outcomes. So through quality of care, we'll be continually updating the board with the process in the community with the process. And I really want to thank, all the staff, but there are some key users out there that really went above and beyond, and we'll start recognizing them, be it amongst the professional staff, the employees, what we call our super users that really helped all of our staff members because not everyone is as comfortable on new systems than others, and some others pick it up quicker than others and they help. And also the Transform staff and the staff from the various other hospitals in our Erie St. Clair that went first. And just like our staff helped them, they came and helped us, and some staying longer than anticipated to make the transition that much smoother. So I really want to thank our partners in Erie St. Clair who have been very helpful, along with Transform, which is the IT company, which is for the whole Erie St. Clair. The teams have done an amazing job. And then, like I stated, our frontline staff have done a great job. So I'll jump into an update on everything where we sit now in our region with respect to COVID and what the future looks like. So I'll share my screen. Can you see that? Beautiful. So the first thing is where do we sit with some of the most recent data regarding the positivity rate for Ontario? So you can see Ontario here is at 9.34%, and this data is about a week old. Peel, unfortunately, is close to 20%. Toronto's very high, York, Durham, Niagara, all above the provincial average. And then we drop down where Windsor is still relatively high, but stable in the sense that what we've seen in advance coming out of wave 2 into wave 3, and our numbers on a daily basis have been pretty consistent when it comes to the total raw numbers of positivity, as well as our positivity rate is of there. And I'll have more to say about why we think we have avoided wave 3. Unlike some other areas in the province of Ontario, we've had certain things happen heading into wave 3, which has helped us, and we'll talk about that a little bit later. So this was from the science table, and if you recall at the last board meeting, it had indicated we were going to get to this pinnacle time about May 8th, the weekend of May 8th, and we were going to go in one of two directions. And the concern was we were going to go in a direction where instead of having, say, 700-800 ICU patients COVID positive in the province of Ontario, we were going to go to 1,600. We were going to double. And that's where that stay-at-home order came into place. And once that stay-at-home order came into place, we saw numbers not so much dropping, but they've plateaued to the point that last week they had predicted that this week, or a couple weeks ago, they have predicted now that as of May 6th, we should have 925 to 937 COVID positive patients in ICU beds. Today, actually, the number is 868. is the number of COVID positive patients we have in ICUs across the province of Ontario. So, so that's what we have right now, rather than the 925 to 937. So basically what the science table indicated is if we have weak measures, public health measures from this point on, then the number will move up to 14. However, if we have moderate, it'll start dropping. And if we have stronger measures than what we even have now, then it'll drop even faster. So the concern is we are going to be, at this number for a little bit of time and dropping a little bit. We have to remember we have approximately 2,300 base ICU beds in the province of Ontario. So this is close. This is about 40% of our ICU beds are occupied by COVID positive patients as it stands now. And our concern is it's going to take a while to get this number down. If you recall, when we came out of wave 2, the highest number of COVID positive patients in the ICUs was 421. It dropped to approximately 200, and then we started into wave 3. The concern is we cannot afford as a province to have 868 or anywhere near that number of patients in the ICU if we come out of wave 3 too quickly and then get into a wave 4. This number's got to get down to 200 or arguably less in order to be able to address that. That's going to take time, and that's what I'm going to highlight as some of the issues. So hospitalizations, are flattening, but ICU occupancy will continue to rise. And you'll see from these numbers what's happening across the province of Ontario, again, not so much in Windsor, Essex, is the number of COVID positive patients coming to the hospital. Hopefully will start flattening out, but in the normal progression is those patients will start to go into the ICU, a certain percentage of them. Say 20, 30% of those patients that are hospitalized with COVID will find their way to the ICU. So we haven't seen the full ramifications of that yet. That's what's going to unfold over the next week or two. But again, the number, hopefully, they say is supposed to stay at around 1,000 and not go above that. Maybe we'll be under 900, but still 900 is a big number to have in 2,300 ICU beds. So we haven't seen, we're definitely not out of the woods yet, nowhere near out of the woods yet provincially. Because again, the patients who are just being hospitalized or have been hospitalized recently haven't made their journey into the ICU yet. So we're going to see that unfold. The concern that was raised by the health table, by the science table, and that we're raising is this point here regarding as occupancy continues to rise, it'll be some time for the restart of surgeries. They can't start immediately. We can't just flick a switch because again, the beds these hospitals are needed for COVID positive patients that are in these hospitals now in the GTA. And at the same time, the ICU beds are needed for surgeries with 800, 900 patients in the ICU or half our ICUs occupied by COVID positive patients. It's hard to flick a switch and go, okay, we're back to pre-COVID. We're going to go to 100% or 125% of the surgeries to try to catch up. That's going to be very difficult to do that, and it's going to take some time. What we have to talk about as a region, as a province, is the existing use of ICU beds. Is there a way to examine which patients post-operatively are going to ICU as compared to which ones maybe don't need to go to ICU? Take advantage of this time to examine those issues from a clinical pathway and determine which patients historically we've treated that way that we don't need to treat that way anymore. Look at what other jurisdictions are doing, say the UK, United States, take the best practices. And this is not only locally, this is provincially. This is across Canada, because again, we have a limited amount of ICU beds and we have a limited amount of critical care staff. Is you can't just, these people are not sitting at home for the last year, not working, and all of a sudden they appear and can help staff a critical care unit. These individuals are not around. And if they are, they've been hired by the various hospitals to help. So we have to look at that and look at the fact that over the next 4 to 5 years, there's not a lot of new hospital, new construction coming online. There's our project, Ottawa, Trillium, all in the mix to eventually come online, but it's going to take years to get there. So what do we do between now and the time those new beds come online in order to maximize the capacity in our hospitals and in our ICU, but taking into account there's a limiting factor, and the limiting factor is our health human resources, not only locally, but also provincially. Just a limit to the amount of people that can be utilized. And at the same time, we have staff that have been working nonstop for 13, 16 months. They are going to need to recharge their batteries. And we have to take that into account, not only us here, but across the province as well, as things evolve. So this is not going to be easy coming out of this for any of us to flick a switch and say, oh, it's back to normal, or even more than normal. We're going up to 125% of the surgeries we're doing now. That is not practical. That's not possible. We are going to have to get ready for a world that we're still going to have COVID positive patients occur that come into the hospital. We're not going to have 100% vaccination rates. So unfortunately, we are going to have COVID positive patients come into the hospital that are eventually going to need the ICU. Where that number is going to go provincially, is it going to go as low as 200, 150 and stay at that for months? There's a good chance. And that's going to be some of the projections that are going to start coming out now. As a result, that's still 5 to 10% of our existing ICU beds that are in effect taken out of commission to take care of COVID positive patients. We have to take that into account, that that's how, you know, the surgeries that will not be able to happen if they need access to those beds. So that's where we have to get into the clinical changes with respect to the use of ICU beds, and some of the work that's has to be done regionally and provincially as well. So just to give kind of a highlight with respect to where we are with our transfers from the GTA. So if you go back to when we started taking patients from the GTA a couple weeks ago, up to basically 4 o'clock this afternoon, we've taken 54 ward medicine patients from the GTA. 3 more patients are going to be coming to Windsor Regional Hospital this Friday and Saturday. Up to this point, we've taken 16 ICU patients. We have 1 more who's going to be arriving today. So in total, with the ward and ICU, we've taken 70 patients from the GTA and or London. The positive part is 28 of these patients have already been discharged home. So when you look at our statistics for today, we currently have 48 total COVID positive patients in the hospital. 8 are from our region, 40 are from outside of our region. So that's very positive. Now, heading into next week, we're going to continue helping out the GTA because they still have some issues, as I indicated previously. And we're going to be accepting the week of May 13th, another 10 ward medicine patients, plus any ICU patients that are being identified through the critical care process with respect to them. So to just give you some perspective on this, is our West region, which is from Hamilton all the way to Windsor in the Grey Bruce Peninsula, as a whole, has accepted just under 450 patients from outside of our region. let alone what happens from inside of our region and the maneuver of patients on a daily basis to load balance in Erie St. Clair between ourselves, Chatham, Blue Water, Hotel Dieu, and Erie Shores, and the work we do together in order to accommodate that. So what I'd like to do is ask Karen Riddell to speak to, because what is lost here is the work that the team has done, in addition to everything else we're doing, on a daily basis to ensure that these patients are transported here on a safe manner, and the work that's done from the clinical leadership, the non-clinical leadership, in order to transfer 70 patients into our facility on a safe basis with our partners like Essex Windsor EMS, Chatham EMS, and Sarnia Lambton EMS. So I'll let Karen explain how that process works.
Sure, thanks, David. So as you can imagine, coordinating all of this across the Erie St. Clair in partnership with the province is quite complex. So I'll just start with the beginning. So our operations table, which has representatives from each hospital in the Erie St. Clair, so Blue Water, Chatham, Hotel Dieu Grace, Windsor Regional, and Erie Shores, meet daily, 7 days a week, and twice on Wednesdays. And what we talk about is capacity across our region, so both medicine, surgery, and critical care capacity, as well as staffing, so that we know where we sit within the region and our capability of accepting both our own community's demands from a patient perspective, but also what's our capacity to help the province. So we generate a report from that meeting every day, and all of us are aware what the plan is moving forward in the next 24 hours for who can accept how many patients. So we really leveraged this work a few weeks ago, it seems like years ago now, when the opportunity to work with Trillium came up. And we had met with Trillium to see how we could assist with facilitating the transfer safely into Erie St. Clair. And we came up with the idea of a partnership. So previous to that, hospitals in Toronto were transferring out multiple patients a day to multiple different hospitals. And so it was tabled to the province and agreed upon that we would partner one hospital with one hospital. So Trillium chose Windsor Regional for the first group of patients. And as David identified, we've transferred a large amount from Trillium since we started this work. So what we do is we meet with the Trillium leadership every day, including their utilization team. And we also meet with our EMS partners. We identify our capacity for transfers. We identify who Trillium Health has to transfer to Erie St. Clair. And we coordinate not only where those patients are going to go, but we also book EMS. So rather than relying on having Toronto ambulances that are trying to service the challenges that are occurring in the Toronto area, we send our teams from Erie St. Clair. So both our Windsor Essex EMS as well as the Wallaceburg EMS are on those calls with us each day. They send trucks at 9 o'clock in the morning every day so that they are in Toronto ready to pick up the patients as soon as they are confirmed and identified. So that helps us shorten up the time for transfer for these patients and the delay in getting them back to Erie St. Clair. So we have that communication occurs, like I said, every day. We plan for the next 24 hours. The trucks are on the road. We confirm all of the patients that are going to be coming. Our physicians speak with their physicians at Trillium. We do the nurse-to-nurse handoff, and our patients are back from Toronto into Erie St. Clair, so to Sarnia, Chatham, and Windsor Regional Hospital, typically by 6 o'clock each night. And then the following day, we do the same thing again, but we also debrief on any of the challenges that occurred the day before so that we can continue to make it more efficient and safer for the patients that are coming down. Last but not least, actually most importantly, is really ensuring that the patients that are being moved from the GTA have a good experience, or as good as we can make it. You can imagine that the stress that the families and the patients feel having their family members moved so far away from home. It's not bad enough that you might be experiencing COVID and be separated from them in the hospital in your hometown, but to move 4 hours away. Our director of medicine, Christy Cecile, calls those families every day as soon as they arrive. We provide them with a package before they even leave Toronto so their families know where they're going. They have all the contact information. And then, of course, we use our virtual assistants to facilitate the FaceTime calls every day to keep them connected. And then, as David mentioned, we have had great success and have discharged many of these patients back home. And we organize and ensure that all the transportation costs are paid for so that that patient can have a carefree transport back home. I also want to recognize the work that Teresa Morris, our Vice President for Flow, has done. She has worked tirelessly over the last few weeks, every day of the week, meeting multiple times a day to coordinate and ensure that these transfers are occurring safely, not just to Windsor Regional, but working with our partners at Sarnia and Chatham to ensure that that's happening in a great way as well. And I do want to recognize also the work that Erie Shores and Hotel Dieu Grace has done to help support also Erie St. Clair and the load balancing that David talked about. The other part that's important as we're bringing these patients in is that we are maintaining capacity across Erie St. Clair and ensuring that as we take patients in from Toronto, that we are managing to maintain capacity for the rest of our community's needs. So honestly, we're very lucky, as I think we've mentioned many times. We work very well in Erie St. Clair, and I think this has been a great demonstration of how we can leverage that capacity and that teamwork to really support the rest of the province. So just wanted to thank the team for all of the work that they've done to allow us to do this safely.
Yeah, thanks, Karen. And just to complicate things, Matt, further, is even though, say, tonight we have an idea of who is, Trillium has an idea who's going to be the 5 or 3, it's 3 now, 3 coming tomorrow to Windsor Regional Hospital, and they try to identify them. By the time our trucks get there tomorrow, there's a switch. So back when we were doing 5 a day coming to Windsor Regional, there were days where 2 or 3 names would change pretty much at 11 o'clock in the morning. Is 2 or 3 of the 5 who were planning coming down were not stable enough and took a different turn in their health, and 2 or 3 more had to be identified. So the work that's done as identified by Teresa, by, you know, Larry's team, Ian Mazzetti, Dr. Mazzetti, Dr. Jacobs, Dr. Saad, the whole team, to communicate and be ready to move quickly to get that physician-to-physician transfer done, the nurse-to-nurse done, to be done safely and identify new patients. This is not simple. What we put into place, and this is new for the province too, like it's one thing, the province knew how to transfer critical care patients, and we've transferred critical care patients, and some might think, well, this is just transferring critical care patients. Not 5 at a time. It's different. And again, when it's a critical care patient, yes, those patients can change and be unstable for transfer, but it's pretty nailed down as that particular patient's the one that's got to go, and you don't replace that patient with somebody else on a critical care transfer. It's that focus, they're either going or not going. In this case, again, we're going up to pick up 5 patients. We know we're coming back with 5. The 5 we're going up to pick up might be different than the 5 we're bringing home. And that happened every day. And the team had to be able to move rather rapidly on that. And EMS did a great job, and they're going up there every day like clockwork, and they know they're going to get there. And you got to remember, they have a time limit too, is they only have so many hours in a day that they can work. Not because they can't work overtime, but they're driving. So we got to do this very efficiently, as they got to get up there. We got to efficiently and safely load a patient on the EMS and safely bring that patient home within a finite amount of time. So, and we got to do it every day. So you can't say, oh, well, you didn't pick up 5 today, so you'll pick up 7 or 8 tomorrow. No, We got to pick up 5 today to help the sending hospital relieve that pressure from them. At the same time, accepting 5 new patients a day, in addition to everything else we're doing at the hospital, that's 5 very sick patients. And as a result, it is very, the receiving hospital has to be ready and the team has to be ready and has to do a lot of work to take care of these patients when they arrive in a safe manner. And it's gone very well. As Karen said, we contact every single family. It's stressful enough. And so 5 ambulances head up on a daily basis and 5 ambulances come back. The cadence has been 3 from Essex Windsor, 1 from Chatham, and 1 from Sarnia. Go up on a daily basis, as Karen said, first thing in the morning, arrive outside of Trillium's 1 of 3 sites, pick up the patients that have been identified and bring them back home safely. Have done an amazing job with respect to that. So again, I could go on all night about the teamwork that is done to pull this off. As stated by Karen, Teresa's up all night, all day and all night. And the team on the ground accepting the patients and the physicians having the morph really quick as they're prepared. They've reviewed the charts of 5 patients. They're told at 11 o'clock in the morning, guess what? 3 aren't coming down. Here's 3 new ones. You got to review these charts. And it's not a situation where it's like, okay, instead you can review 15 charts the night before and we're only taking 5. Well, that's not fair to anybody either. So it's been used as a, but I'm on the provincial transportation calls and this is used as a model. And they've done some other things provincially, but they left ours alone because it's working so well. They're like, you just keep doing what you're doing because it's working well. And we'll keep you out of what else is going on in the province with respect to the transfer. So what we got is working well. And our team works very well with Trillium. They're a great team to work with, an amazing hospital, amazing team. They know what they're doing up there and we're trying to help them. And in effect, they're also helping out William Osler and other hospitals in the GTA that are just in a difficult spot. So that's a transfer situation. Still got some more stuff to talk about.
David, we just have a quick question,
yes.
I believe, from Dr. Jacobs.
Yes.
Not so much a question as much as just I wanted to let you all know. So being a receiving physician this week and taking these patients, uniformly, the patients and the families are so appreciative. And I just really want to compliment all of the back work that's happening because this would be a disaster if there wasn't that communication. And it really is working quite well. So I wanted to congratulate all of the administrative team for what's been happening. So,
well, thanks, Dr. Jacobs. And again, it's a full team effort. And interesting enough, I mean, we've learned a lot during COVID, and where we learned a lot is transferring patients from long-term care to the field hospital. And some of the things we were doing there, we carried over into these transfers. But yeah, it's an amazing team effort that I need to express. It's not as simple as just saying, oh, it's 5 patients a day, it's easy. There's so much work involved behind the scenes to get those patients here safely. It is quite amazing, and it's gone very well. And hopefully it stays that way as we keep moving on into this next week. Just some of the stuff I hear in the community that I really have to put an end to, at this point in the pandemic, it really gets to you sometimes. People are concerned by taking these patients into our community is we're increasing our positivity rate. No, these patients are positive from their community. It goes back to their community. We don't get the quote positivity rate, so these patients aren't counted in our numbers. And even if they were, who cares? But aside from that, it's my inside voice. But they're not, all right? Number 2 is we have an obligation to take care of Ontario residents. And there's no way we're going to be standing around with our hospital with excess capacity and watch hospitals struggle in the province of Ontario. They didn't do that during wave 2. They helped us out and our region out. And when I hear people say, well, maybe we shouldn't, help them out and because we're doing okay. And the sooner we get out of this, the sooner we can get back to normal. You know what, folks? No, That's not going to happen. We have ethical, moral, all sorts of obligations to help out fellow Ontario residents to get through this. Because, but the grace of God, we're in a great spot right now with respect to wave 3, and thank God we can do this. The analogy Karen Riddell gave to me before is so true. It would be like us sitting at a fire with a fully charged hose and not turning the water on. We got to turn the water on. We got to help. And we have an obligation to do this, and I can't be prouder of our team for doing what they're doing with respect to saving people's lives. And that's what we're doing. We're saving Ontario residents' lives. So the team's amazing for doing that. So getting on to different topic, but we're talking about, you know, the variants, replication, mutations. And there's a couple quotes I put up here that are so key about what we're going through right now and how close we are to really making things a lot better for all of us. And one of the issues we have to talk about is this issue of replication. You hear about mutations, you hear about the creation of variants. The way you stop mutations from happening or variants from happening is you get rid of replication, meaning you reduce the spread of COVID. The way you reduce the spread of COVID primarily is 2 ways: following public health measures, number 1, and number 2, getting people vaccinated as quickly, as efficiently as we can. That's the way, is you stop replication, you stop mutations, you stop variants. And as stated by Dr. Fauci, is he estimates that, and he's talked about this over and over again, is if we can get 70 to 85% of our population vaccinated, we stand a chance to create what's called herd immunity and avoid replication, the reproduction of the virus, which then will reduce the chances of mutation and will then reduce the chances of variants. Because what the science table stated, the concern is, if we're probably going to have a wave 4, and I'm not saying we're going to, I don't want to freak people out, but if we're going to, it's going to be as a result of a breakthrough of the vaccines, meaning there's a variant that is created as a result of replication, as a result of mutations, that spreads rapidly, that breaks through the vaccine and makes the vaccine's efficacy a lot less, to the point of people can catch COVID, get serious health issues, hospitalized, death, etc. That's what wave 4 will look like if it happens. So the way to stop wave 4 is public health measures. And when your time comes up to vaccinate, get vaccinated. Can't be stressed enough. So we're following what the province vaccination scheme is, and we're going to be heading into this week here. And very shortly, you'll hear, as projected, is the health unit will look at moving us to everyone, you know, the whole age group as 40 plus. We already have done the at-risk health conditions, and we just started today. The cannot work at home group is being done as well, and we're making progress there with respect to that group. And before I hand it off to Dr. Saad with respect to where we're at in vaccinations, here's a couple charts from public health and some statistics. So if you look at our coverage area, this is dated last week. So it's about a week old in data, but we have some amazing coverage with the 80 plus group, all these groups. Some very, very good coverage with those ages. We're really picking it up with respect to the 55 to 59. And these are the groups we're going to hit next. And we're hitting them now. And we're going to start hitting them in earnest over the next month as we get to that 18 plus group. So these statistics show overall, about a week ago, we were at 33.8% of our overall Windsor-Essex population has been vaccinated with at least 1 dose. That number as of yesterday is almost 38%. Today it would have tipped it over because we vaccinated another probably close to 4,000 people. We'll be over 38% of our total population, which is total number of doses administered 179. Those with at least one is 165. The population 18 and over is approximately 300,000. Not the 400,000. There's about 100,000 people that are 18 and under. And even though NACI has approved 12 to 15, the province is still working out the details about how to vaccinate the 12 to 15 age group. And then if you heard in the States, they're looking at even the 2 to 12 age group. Pfizer's doing some work on that now to hopefully get that approved. So that's more to come with respect to that. But if we have 300K approximately of the 18 and above, you can do the math, is we're above 50% we vaccinated already with one dose. So when we talk about herd immunity, we're getting there as a region. And if you go back to what we talked about earlier, is why did we avoid the wave 3 that the Toronto or the Peels avoided? Dr. Ahmed's talked about this, is we earned the ability to get more vaccines for our region by having a really bad wave 1 and wave 2. And we got these vaccines. We had access to not only Pfizer, but Moderna, as well as AstraZeneca in our pharmacies. As a result, we were able to vaccinate a good chunk of our population really quickly. We were very aggressive with respect to getting our population vaccinated. And that's why we have these types of numbers that I identified earlier with respect to these age groups and how great these numbers are with respect to vaccination of these age groups. And we did it quick. The rest of the province is now starting to catch up with respect to us as more vaccines come out. But one of the reasons we've been able to avoid wave 3 is because of that aggressive nature with respect to vaccinating people, getting those doses in arms, not keeping them in freezers, working together with WeChew and the city of Windsor to get people vaccinated as quickly as we can. And I think as a region, we've done a really good job with the number of vaccines we had, and we took advantage of it. And that's one of the reasons we didn't have the wave 3 others did. Second reason, public health measures. Yes, we have our isolated incidences that need to be dealt with where public health measures are being violated and they're being dealt with. But overall, our community's done a very good job with respect to following public health measures. And number 3, if it wasn't for that stay-at-home order, I don't know. We were at that point where we were starting to get a steady number of cases. If we didn't have the advantage of that stay-at-home order, I think our numbers would have kicked up a bit. And could it have got to a point of something really bad? Possibly. We could have been more like a Toronto Peel, maybe not to that extreme because of our vaccines, but we could have got to a point that we could not help out the rest of the province like we're helping out now. Because again, as I showed you, we have 8 patients in our hospital from our region. That's a number that we haven't seen for quite some time, how low that is. So that's very good. So I don't know, Dr. Saad, if you want to talk about vaccines and how it's affecting even the admissions to the hospital overall and the patients we're not seeing.
Thanks, David. Yeah, I think you said it in terms of the major factors that prevented us from having the severe third wave that most of the rest of the province had. I think it's mostly our vaccination efforts combined with the stay-at-home order. But we can tell in the early parts of the pandemic, the patients that were presenting to the hospital and the patients that were occupying our ICUs were predominantly in the 60 to 80 plus range. And then once we reached really essentially herd immunity in that age group with an 82.4% vaccination rate, that demographic essentially disappeared from the hospital. Nursing home patients, retirement home patients, long-term care home patients just stopped coming to the hospital. That we weren't admitting them with COVID. So clearly the vaccination efforts have worked. We do know from recent ministry data that the chances of somebody having a breakthrough infection with COVID after they're fully vaccinated is extremely low. They've looked at patients who've been admitted, who've received a dose of the vaccine. The vast majority, about 4,500 out of 6,500, got the infection within 7 days of getting their first dose. So we know that that's too soon for anybody to develop any type of immunity. And only about 4% of people got COVID after they received 2 doses. So that clearly tells us that vaccination efforts are working. They're preventing people from getting extremely ill. We knew that no vaccine is 100%. These vaccines, even are about 95% effective. So we're still going to have some people getting severe illness, but you can tell the dramatic drop in that age demographic that David just put up in the graph compared to where we are now, where most of our ICUs are 20, 30, 40, 50-year-olds. We're not seeing the 60 to 80 plus year olds anymore. And if we continue with this vaccination program and we get to that herd immunity, I think you're going to notice a dramatic difference in the number of ICU patients with COVID. It's going to drop significantly.
Thank you, Dr. Saad. With respect to that, that was the end of it. So subject to any questions, last thing I want to talk about in the public session is just, we saw last week, there were 2 reports that were issued, one by the Auditor General, the other by the Long-Term Care Commission, that Dr. Chevalier and myself presented to, and the Commission's final report was released. The Commission's report had some 85 recommendations in it, and it just talked about the issues heading into COVID that pre-existed, what happened during COVID, and where we're at now, and some of the positive work that's been done. One of the things they did highlight clearly is the positive relationships that have been created during COVID between various hospitals across the province and long-term care and retirement homes, which we have developed direct relationships with 21 that we still talk to on a weekly basis, still visit, still help, work as partners to try to address any issues in partnership with them. And that's a relationship that the committee, the Commission recommends continues, and there's more formality to it across the province. Also, what the Commission did identify, once again, they did it in their second interim report, is just the work, they use words like resourcefulness in creating the field hospital, and that the timeliness that took place. It's been a year and over a year, and just Ms. France is on our board of directors. Just St. Clair College, again, I just remember at the time, Lieutenant Colonel Andy Stewart, who's a retired member of the Canadian Armed Forces, was with our team, and we went to various sites with him to examine the various sites to get his help on creating a field hospital. That's something we've never done before. And we were looking at gymnasiums, pretty much, school gyms, elementary school gyms. And he was like, no. You want to pick a place. You don't want to pick 5 of these places because you don't have the ability to run 5 at one time. You want to pick a place that is large, almost too large for what you need. And make it your worst case scenario, if not like end of the world scenario, and then work backwards. So as we started going to the various sites with them, we landed at St. Clair College. They agreed for us to attend, and they knew why we were attending. And pretty much within minutes of him getting in there and looking around the infrastructure and our team, it was like, this is the place. So we immediately reached out with Patty and said, Patty, do you mind? And she's within seconds. They didn't even hesitate, said, yes, let's do this. Let's get this done. And we were in there, I don't know, within 24, 48 hours, we were in the facility. And, within 17 days with Easter falling in between, we started taking the first residents in the building, which is amazing. And to this day, St. Clair College has been not only the field hospital taking COVID positive residents and saving lives, but it turned into a swabbing center, and now it's a vaccination center. So it's gone full circle with respect to COVID, and we're not done yet, Patty. We still got some more vaccines to go before we hand it back to you. So we're going to finish what we started. And just in the Commission's report, it just highlights the great team at Windsor Regional Hospital and the work that was done, and that they suggest that the ministries look to Windsor Regional Hospital's successful field hospital as a model on how alternative healthcare spaces can be created quickly in a crisis. So that's their quote. And the only way that gets created quickly is with partners like St. Clair College, who allowed us to create it quickly, and their own resources, their own staff was with our staff, bringing in the electricity, bringing the water, as they knew how that building operates and how that building works. And they were the ones working hours, endless hours, to get that place up and running by the time it had to, let alone Lester Construction, Caesars with electrical support. It was all sorts of players were involved with that, as we just asked for anything from the community and they said, okay, where do we deliver it? So it's been quite an amazing journey with respect to that. So that's my report, Mr. Chair.